Angau Hospital houses the only cancer treatment facility in Papua New Guinea. This is where referrals are made from all over the country. But there is a problem. Many of the patients referred to the National Cancer Treatment Facility are diagnosed when the disease is in its advanced stages. Dr. Kenyhercz, Angau's Chief Executive Officer, says the key in keeping cancer in check in Papua New Guinea is in early detection and treatment.
If we took our population at the National Cancer Center, took them anywhere else in the world, had the smartest doctors, the newest drugs, and the best equipment, their results would be the same as we have now. It's because we're getting patients too late in a disease process. We're getting patients at end-stage disease. We should be focusing on not what we don't have, but what we do have. Cancer is treated in three ways, usually in a combination of those. Cancer is treated via surgery. We have surgeons. Cancer is treated by chemotherapy. The PNG Cancer Relief Society supplied this hospital with a year of anti-cancer drugs. And thirdly, we have radiotherapy, and we have a problem there. We have an old machine, it's past its life. A treatment that may have taken 20 minutes at one time now may take up to a day.
For people living in urban areas, getting out the message of early detection is relatively easy. But the hospital management is faced with the enormous challenge of communicating that same message to people in rural areas. Many of those people don't have road access or have little financial means of paying their way into Ley City to get tested.
What we do have here are good surgeons. What we do have is new machines provided to us by the National Fisheries. We have a new state-of-the-art mammography unit because the #1 cancer in this country now, according to the World Health Organization, is breast cancer. We have a new mammography unit. We have a brand new CAT scan machine with the lasers that is yet to be in place. I suspect it'll be ready early March.
Outside the confines of the hospital, what doesn't always get public attention are the financial struggles of the families of patients affected by cancer. Many of the families try to raise funds to seek treatment overseas. On average, it costs anything between 80,000 kina and 150,000 kina, depending on where they choose to go. In the years leading up to 2014, when Ley resident Eddie Nagwa lost his sister to cancer, his family was expected to raise up to 30,000 kina for cancer treatment in Singapore. For many others, the cost is higher.
This money been ready, so I'm been come again to Papua New Guinea without going through long this operation.
Last week, when the Governor-General-elect Bob Dadai visited the cancer unit in Ley, one of the primary concerns raised was the cost of travel, of the diagnosis and patient care. With Angau being the only treatment center in the country, families not only have to pay for the cost of the patient, but also of the people who care for them whilst in hospital. Scott Waide, National EMTV News, Ley.